So in ANCA-mediated vasculitis, body mistakenly produces antibody, autoantibody against its own inflammatory cells, particularly against the neutrophil and also against the monocyte. In the cytoplasm of the neutrophil and monocyte, we can get two substances, particularly seen in the agerophilic granules in the neutrophils. These two substances are proteinase 3 and myeloperoxidase. Now, body in this condition basically produces autoantibody against these two substances, myeloperoxidase or proteinase 3. Now, another interesting thing happens. Myeloperoxidase and proteinase 3 normally is located in the cytoplasm of the neutrophil, but in this condition they translocate to the cell membrane. Now, what is happening? The cells, neutrophil, on their outer surface is expressing proteinase 3 or myeloperoxidase, and the body is also producing the antibody against them, proteinase 3 or myeloperoxidase. So now this antibody can come attached with the neutrophil's outer surface with the antibody against the proteinase 3 would attach with the proteinase 3, antibody against the myeloperoxidase with the attached with the myeloperoxidase over the neutrophil surface. This neutrophil would degranulate, its constituent would come out, and it would inflame or injure the blood vessel lining, causing inflammation, vasculitis, particularly small vessel vasculitis. This is the whole idea of the ANCA-mediated small vessel vasculitis. That means autoantibodies are produced against the proteinase 3 or myeloperoxidase. Proteinase 3 myeloperoxidase translocates in the cell membrane. These when they translate to the cell membrane, what would happen? That now they have access to the antibodies which are roaming in the blood. Now the body is also producing antibody against the proteinase 3 or ANCA. They would attach to the neutrophil's outer surface. Neutrophil would get overactivated. Neutrophil's constituent would come out, and free radicals would be generated, and that would damage the nearby blood vessel lining, particularly the endothelial lining, and that would cause the inflammation of the blood vessel wall, which is called vasculitis. I would continue this discussion in the second part of ANCA-mediated vasculitis. Thank you so much.